James Madison was the fourth president of the United States. Ted Kennedy was a senator. Hugo Weaving was an actor in The Matrix. Margot Hemingway was an actress and a model. Shonda Gunn was the winner of a 2006 bronze medal at the Olympics. Bobby Jones was an NBA All-Star basketball player, and I was Miss Bob Jones of 1976. What do all these, quote, famous people have in common? They have all had seizures and are being diagnosed with epilepsy. When I was around 12 years old, I had my first seizure and was eventually diagnosed with epilepsy. My first seizure was a grand mal or a tonic-clonic seizure, where I fell to the ground, lost consciousness, and shaked uncontrollably for probably under a minute. Afterwards, I slept a long time. This was due to putting all my energies into having a seizure. The doctors aren't sure as to what caused my seizures. However, my family tells me that my dad may have had undiagnosed seizures. The doctors originally put me on anticonvulsant medication called Dilantin and phenobarbital, but I presently take Keppra. You may ask, what is a seizure? What is epilepsy? Today I want to talk to you about the definition of epilepsy, the different types of epilepsy, the treatments for epilepsy, along with famous people with epilepsy. To begin, let's understand the definition of epilepsy. Epilepsy is a disorder that results in electrical surges inside the brain causing recurring seizures. There we go. At least 2 unprovoked seizures are generally required for an epilepsy diagnosis, according to the staff at the Mayo Clinic. Seizures are symptoms of a brain problem. They happen because of sudden abnormal electrical activity in the brain. When people think of seizures, they often think of convulsions in which the person's body shakes rapidly and uncontrollably. However, not all seizures cause convulsions. There are many types of seizures and some have mild symptoms, according to the U.S. National Library of Medicine. Now that you know the definition of epilepsy, let's look at the different types. Seizures fall into 2 main groups: partial seizures and generalized seizures. Focal seizures or partial seizures happen in one part of the brain. Consciousness is not lost with simple partial seizures. Simple motor seizures cause jerking, muscle rigidity, spasms, and head turning. Simple sensory seizures cause unusual sensations affecting either the vision, hearing, smell, taste, or touch. Simple psychological seizures cause memory or emotional disturbances. Complex partial seizures cause an impairment of awareness that includes automism such as lip smacking, chewing, fidgeting, walking, or other repetitive, involuntary but coordinated movements. Partial complex with secondary generalized seizures cause symptoms that are initially associated with the preservation of consciousness that then evolves into a loss of consciousness and convulsions. The second type is generalized seizures or tonic-clonic seizures, and they happen on both sides of the brain. And there are 6 major kinds of generalized seizures. The first one is grand mal, and they cause unconsciousness, convulsions, and muscle rigidity. Absence seizures cause a brief loss of consciousness. Myoclonic seizures cause sporadic, isolated jerking movements. Clonic seizures cause repetitive jerking movements. Tonic seizures cause muscle stiffness and rigidity. Atonic seizures cause loss of muscle tone where you fall to the ground. Now that you know the types of seizures, let's see how to treat them. There are several treatments for epilepsy. Anticonvulsant medication is the first and most popular type of treatment. Keppra-Dilantin, phenobarbital, Tegretol, and Trilipitol are among the medications used to treat epilepsy. There are side effects to every medication. You have to weigh the side effects along with the benefits to determine which medication is best for you. Another treatment is the vagus nerve stimulation, and it's designed to prevent seizures by sending regular mild pulses of electrical energy to the brain via the vagus nerve. And it's also sometimes referred to as a pacemaker for the brain. And it is placed under the skin on the chest wall, and a wire runs from it to the back of the brain, to the vagus nerve in the neck. My 12-year-old granddaughter has a rare form of epilepsy, and she has the VNS. And it has cut down about 70% of her seizures. Another treatment is dietary therapies, such as the ketogenic diet and the modified Atkins diet. The ketogenic diet is a special high-fat, low-carbohydrate diet that is prescribed and monitored by a physician and nutritionist, and can help control seizures in some people. Also, the modified Atkins diet, which has some similar components to the traditional ketogenic diet, can be effective as well. And then brain surgery is the last resort treatment for epilepsy. It is a procedure that either removes or isolates the area of your brain where your seizures originate. Epilepsy surgery works best for those people who have seizures that always originate in the same place in their brains. To be considered for epilepsy, you must have tried at least 2 anti-seizure drugs without success. If 2 of the drugs have failed, it's highly unlikely that any other drug will help you. Even though epilepsy can be debilitating, someone who has their seizures under control can make great contributions to society. There are many famous people with epilepsy. U.S. President James Madison was said to have had either epilepsy or psychogenic seizures, with historian R.A. Rutley in 1987 reporting Madison to have monthly high fevers, diarrhea, and seizures similar to those suffered by epileptics. Senator Ted Kennedy first manifested his brain tumor by having a seizure, and subsequently he had others. Hugo Weaving, who played the leader of the elves in The Lord of the Rings and the villain in The Matrix, indicates that he has been treated for epilepsy since the age of 13. Margot Hemingway, actress and model, was the granddaughter of Ernest Hemingway and sister to Mariel Hemingway. She was taking phenobarbital for lifelong epilepsy and possibly died from an overdose of phenobarbital and alcohol from the combination of it. Shonda Gunn was a goalie in the 2006 Winter Olympics U.S. women's hockey team. She has had seizures since age 9 and serves as a spokesperson for the Epilepsy and the Epilepsy Therapy Project. Bobby Jones was an NBA basketball player for 13 years. He took medications for epilepsy during his athletic career. So to review, epilepsy is a seizure disorder resulting in electrical surges in the brain. There are 2 types of seizures, main types, partial and generalized seizures, and there are several treatments for epilepsy, with medication being the most popular. Even though it can be debilitating, people with epilepsy can also make huge contributions to society. So the next time you encounter someone with epilepsy, don't make jokes about them. Just remember what you have learned today so you can enjoy getting to know this person rather than being afraid. Thank you.